can see cases go down just as quickly if the American people will do the things that we know slow the spread of this disease, including wearing a face covering. Critically important for people to know COVID stops with me. We have the power to turn this thing around.
Okay, let's start there then, because you are wearing a mask. You are clearly trying to make a point. At the beginning of April is when the administration started telling the public to wear masks. But just the last time you were with us here on Face the Nation, March 8th, you said this. Let's listen.
And stay safe by washing your hands, by covering your cough, by staying home if you're sick. Masks do not work for the general public in preventing them from getting coronavirus.
Right. And the week before that, you tweeted in all caps, "Seriously, people, stop buying masks." You said they were not effective. Do you regret saying that?
Well, it's important for people to understand that once upon a time we prescribed cigarettes for asthmatics and leeches and cocaine and heroin for people as medical treatments. When we learn better, we do better. And the WHO,
are you saying at that time you did not know, because the CDC in February was looking at asymptomatic transmission of the virus?
We were looking at that, but the CDC, the WHO, and even in May there was a New England Journal of Medicine article that still disputed whether or not masks were effective. We've learned more about asymptomatic spread. Up to 50% of people who can spread this disease spread it without having symptoms. And that's why the American people need to know that science is about giving the best recommendations you can. And when you learn more, you change those recommendations. Our recommendations have changed. Now, people of America, important to know you should wear a face covering.
And we certainly do.
When out in public.
We certainly do take that advice, but I think you have to acknowledge that this mixed messaging has created confusion, and it has drawn into question some of the credibility of the administration. Are you certain
and we're trying to correct that messaging, Margaret, but it's very hard to do.
Well, I'd like you to clarify it. Were you saying that then because there just wasn't enough equipment?
I was saying that then because everything we knew about coronaviruses before that point told us that people were not likely to spread when they were asymptomatic. So the science at the time suggested that there was not a high degree of asymptomatic spread. We learned more. There also was, as you mentioned, the very real concern about hoarding of PPE and people dressing up in trash bags as healthcare workers. That was a part of it, but the primary reason was because that's what the science said. And I want the American people to understand we follow the science, and when we learn more, our recommendations change. But it's hard when people are continuing to talk about things from 3-4 months ago. I've said consistently for the past 3 months, ad nauseum on the internet and in interviews, wear a face covering. It helps slow asymptomatic spread. It will help us reopen churches and schools and have prom next year and have football in the fall.
Right, which is why I think leveling with the public is important. I want to also get to something very specific in terms of